Dear Paul, thank you very much for the kind invitation, and I welcome you very much to the lung ultrasound examination protocol for assessment of COVID-19 patients webinar. So, what are the points of my talk today? First of all, I'd like to give you some very local impressions about clinical lung ultrasound in the era of COVID-19 based on the experiences in our university hospital. And I'd like to show you some case reports, and in the end of this very small presentation, I'd like to conclude. Clinical lung ultrasound in the era of COVID-19. What do we all have to think about performing ultrasound in these patients? So before we start having a look on some ultrasound issues, let's have a look first. What about the clinical algorithm of these COVID-19 patients in clinical life? So I'd like to share you some experiences from our university hospital, Klinikum Rechts der Isar of the Technical University of Munich. This is special because I think every hospital in Europe has its own algorithms and its own ideas about how to manage these patients. In our university hospital, we check the patients in the ICU for respiratory rate. We are checking fever, these are the two main parameters, and if there's a suspicion, we proceed to native low-dose CT of the thorax. This is special in our hospital. This algorithm was also published in the German Doctors Journal, and it was very useful, and we had a really great expert team establishing that algorithm that was really very good in the last months. So why ultrasound? You didn't see the word ultrasound in this algorithm so far. So I think what is the main thing? We have a bedside impression of the patient's lungs. The use of this ultrasound stethoscope, which is pocket ultrasound device, provides more and more relevant information than the traditional stethoscope. Our experience is you don't hear a lot using the traditional stethoscope in these patients, and it's not very helpful. Then ultrasound is an imaging technique for patients who are too ill to be delivered to the computer tomography, e.g. at the intensive care unit. Yes. So these patients can get a bedside imaging technique, and you don't have to transport them at all. Last but not least, the follow-up of COVID-19 patients might be very good with ultrasound. You can see signs of superinfection maybe, or progressive lung involvement. Well, this has to be confirmed in larger studies, but these are things that really have to be kept in mind. So what about the daily life? And you can here see our staff nurse Johanna wearing full protection equipment. And especially in these times, I felt very much reminded to Herodot. And he said, quid agis prudenter agas et respitsa finem, which means whatever you do, do it wisely and consider the end. So before you go to the patient, you have to be prepared. Prepare before you scan. Self-protection is a top priority, especially in positive COVID-19 infection. Use full personal protective equipment against droplet and airborne transmission, and there is a close contact with the patient, which is absolutely unavoidable. Try to limit the scanning time in these cases, and the exam starts before you enter the room. Please keep that in mind. Be in fact ready for the exam. Check everything. Do you have your gel? Do you have a cover if you're using one? If you're working with handheld devices, is the battery okay? Keep these things in mind. and use adequate hygiene protocol for the ultrasound device. Protective plastic cover for the ultrasound device may also be discussed. Some say it's not really necessary. We are using it just to be really safe. So we are really wrapping ourselves, we are wrapping the machine. So I felt a little bit reminded to Christo with his wrapped Reichstag in Berlin. And this is us wrapped. This is our staff nurse Johanna, this is me, and we're wearing these shields, we're wearing FFP2 masks, just some protection hats and some protection clothing available in our hospital, and 2 pair of hand gloves. This is our machine. We're using a pocket ultrasound device, and you can see we fully wrap it into a plastic bag, and well, it's very easy to work with a machine like this, and we think it's very well protected. And after that, we're using normal disinfection to make sure that this is really okay after it has been into a room with COVID-19 patients. This is my colleague Dirk. He's scanning on the other side of the river Isar in Munich, and you can see Dirk here in the ICU, scanning with a high-end ultrasound device, and he's wrapping up the whole device with plastic bags that are normally used in interventional radiology or in urology operation theaters. Can be useful, and it's of course a very easy way to protect, especially the keyboard, which is really very hard to disinfect. So how to scan? My talk should be about protocols and about a protocol we developed together with friends from Germany, Austria and Switzerland. So we've had a look on several protocols on the market, starting from the old Volpicelli one with these 4 regions, and more extended ones with up to 12 scanning regions on every side of the lung. So we think this protocol with these 6 regions is very, very much practical for the use of COVID-19 patients, because you've got to go with a compromise to really shorten the time of scanning and to get as much information about the lung areas as possible. Thinking about the positioning of the patient is a very good idea before you start your ultrasound exam. So remember, you've got the regions 1, 2, 3, 4, 5 and 6, and you can see, especially when you want to access the region 5, you're in trouble if there's the arm of the patient. So what you can do is you can ask the patient to put the arm up, then you can easily achieve the region 4 and the region 6, and it's much more space for you to work. And what you can also do is you can ask the patient to turn a little bit to the side, and then you can pretty nice access all the regions on the back, so region 5 and 6. As you have to scan both lungs, consider to scan the patient's left side from the left side of the bed, thereby avoiding stretching across the patient, with that increases face-to-face proximity considerably. And you can see me here scanning from the left side. This is in fact very easy. You can ask the patient to turn the face in the other direction, and so I think it's really safer and it gives you more security. And most of all, ask the patient to lift up the arm also on this side, just to get a better overview as soon as you're entering the regions 5 and 6 especially.
What we found out to be helpful is we start scanning the regions, and after, for example, this is region 1, we are finished with this region 1. I go ahead and I press twice the save button, and then two black pictures are stored, so I can see, okay, this is the end of region number 1, and then we go ahead to region number 2 and scan again, do images, do video clips, then remove the transducer again, and then we press save again, and we save another 2 black images to separate one region from the other. And after that, on our pucks, we know which region we scanned, so this is quite helpful.
This picture, without the adequate social distancing, of course, this is one of our students, should show you one thing. We are using these handheld ultrasound devices on the ICU for obtaining the lung ultrasound protocol in COVID-19 patients, and we prefer this team style, which means we've got one person doing the scan, the other one filling in the protocol right away. This is really saving time, as you can use the protocol right after the exam, and it also ensures you to have a look on all regions and to have a look on all criteria, which are really important for getting the right impression. A second, and as I think very smart possibility performing the lung ultrasound, is using these battery-driven machines. And they've got a really nice thing on it. They've got an ultrasound protocol, which is really leading you through the different areas. And as you can see on the next picture, you can also fill in the criteria you found in a special area, and it's just saved. It gives you really a very good feeling, because you don't forget an area. You can have a look on all these criteria and can just press on the touch screen the criteria, and then it's just on the picture, which is very helpful for writing the ultrasound report later on. So if you're on your own and if you don't have a second person filling in the protocol right away, this is a very easy access to perform the ultrasound exam on your own in a very short time. So I call that device-based exam protocol. Here you can see the touchpad, and you can see these are all the areas, these 1, 2, 3, 4, 5, 6, and there you can see the criteria that have to be asked yourself, so to say, when you scan every area. So finally, I'd like to present here our lung ultrasound protocol, which was supported by the German, Swiss, and also Austrian Society for Ultrasound. We are using this protocol in the daily practice of COVID-19 patients, and we consider it to be very useful. You can download it for free on the FSOM homepage. On the back side of the lung ultrasound protocol, you find some definitions, you find some advice on the device settings, and of course the definition of all the criteria we're testing in this lung ultrasound protocol. We also put some helpful literature on this protocol, where you can also get some nice pictures and advices from people who did a great work all over the world. So, as pointed out before, how to analyze the lungs. As the lungs are filled by air, you can hardly see them with a normal ultrasound scan. So what you can have a look on is the surface of the lungs, the pleura. And especially in COVID-19 patients, you can see some changes in the periphery of the lungs, which are very, very interesting. First of all, the fragmented pleura, as we call it. It's an irregular, interrupted, and thickened pleural line, partly subpleural hypoechoic areas. This is, so to say, the fragmented pleura. Second, consolidations. These are ecopure subpleural areas larger than 5 mm with liver or tissue-like echostructure. The third criteria is the air bronchogram. These are air-filled bronchi branching curvilinear echogenicities within a consolidated area. And the B lines are the fourth criteria. You can see I wrote B lines in quotation marks, which means these are not the typical B lines, but it's a, so to say, combination of classical B lines and cometail artifacts. We put them together in one category and call them B lines in quotation marks, as they are sometimes a little bit hard to distinguish by learners of lung ultrasound and young intensive care physicians. Last but not least, you should have a look on the pleural effusion, whether there's a small, a moderate, or a large volume, which has also been noted on the lung ultrasound protocol. What about the published literature about COVID-19 ultrasound? Let's start with the study of Peng et al. The colleagues from China were analyzing CT and lung ultrasound features of patients with COVID-19 pneumonia. Here you can see thickened pleural line, no problem in both modalities. Ground glass shadowing in lung CT had the equivalent in multiple B lines. Then consolidations of different sizes were seen in both methods. Pleural effusion, this is interesting to emphasize, was rare in both methods in patients with COVID-19 pneumonia. And Peng et al. They concluded that focal B lines were the main feature in early stage and in mild infection, in contrary to the alveolar interstitial syndrome, which was typical with multiple B lines in lung ultrasound. The second paper is published by Buonsenso et al. From Italy. They were using a point of care approach, and here you can see their Wi-Fi transducer, which was paired with a tablet computer for ultrasound. You can see everything is covered in plastic bags to have a maximum of protection. And here you can see some of his findings, very similar in fact to the ones we've seen from China. Lung ultrasound is showing these changes of the pleural line, irregularities or fragmented pleura as we call them in our study, and then you can see these vertical artifacts and the supral consolidations, quite typical in patients with COVID-19. The third study I'd like to present you is published by Huang et al. It's a preliminary study on a small number of patients with COVID-19, but it's a very nice paper to read, as you get a lot of examples for lung ultrasound in patients with COVID-19 pneumonia, and he's also combining pictures of lung CT and lung ultrasound features, which is really quite nice to see, and it's good for learners. And his conclusion was a non-critical COVID-19 patient has characteristic ultrasound manifestations which are visible in the posterior and inferior areas of the lung. This is important to know because these are the main areas of interest when you perform lung ultrasound, so you really have to make sure that you really had a look in these regions. The lesions that Huang et al. Found were characterized by a large number of B lines, pleural pulmonary consolidation, and poor blood flow. This is something which is very hard to believe, as a color Doppler is really very hard to perform. You can do it with contrast media ultrasound, but this is another story. And lung ultrasound can provide a reference for the clinical diagnosis and efficiency evaluation. Yes, this is absolutely what we also found in our patients. Let's have a look on the lung ultrasound protocol used by Huang et al. And Huang was using 6 areas, which I find very easy to use in the clinical standard. And he was describing where he found changes, and you can see these were the regions 2, 3, 4, 5, and 6, where you had the main features. The very medial ones were a little bit less involved. I'd like very much to present you 2 pictures from the Huang et al. Publication. On the left hand side you see the high resolution CT, and mind the red box here. You can see here ground glass opacity under the pleura in the posterior basal segment of the lower lobe of the right lung, and you can also see a air bronchogram. Now let's take the ultrasound transducer. We're using a linear array transducer, and what you can see is we've got changes in the pleural line, what we call fragmented pleura in our lung ultrasound protocol, very typical in patients with COVID-19 pneumonia. And back to Italy again. This is from a review from Gino Soldati and his group, and you can really see these pictures are very, very similar to the ones we've seen from China. So I'd like to show you COVID-19 is really a pandemic, and we are finding the same pictures in different parts of the world. Before my time is over now, I'd like to show you some pictures from Munich. Let's start with a 43-year-old patient with pneumonia. This is our lung ultrasound protocol in clinical routine, and you can see a lot of regions show abnormalities in this patient. These pictures were generated by using a pocket ultrasound device bedside on the ICU, and here you can see the different areas with typical signs. Here you can see in the right area number 1 a fragmented pleura. You can see B lines. In area 4 you can see just the same, and in the left area 6 you can see consolidation with air bronchogram here. This is the CT scan of the patient, and it's very well fitting to the signs we've seen in ultrasound before. Nevertheless, the extent of the disease can very impressively be seen in the CT scan. The second case report is a 60-year-old patient with pneumonia. Lung ultrasound shows consolidations and small air artifacts in the right area 1, in the right area number 5, and also in the left area 1 you can see quite a uniform picture. You can see a little bit of pleural effusion also in this picture in right area 5 here. So this is a really large extent of the disease, and you can see all areas are involved. And let's have a look on the CT scan. What would you expect? This is a CT scan of the patient we've just seen before. You can see extended disease and all areas are involved, just the thing we've seen in ultrasound before. The next case is a 95-year-old patient with pneumonia. So let's have a look at these ultrasound pictures. 95-year-old patient, what can you see? This is region 5 right side, region 6 right side, region 4 left side, region 6 left side. The other regions didn't show such a big pattern of changes, and here you can see fragmental pleura again, fragmented pleura again, fragmented pleura again, and fragmented pleura, B lines, and some consolidation with a bronchogram. This is a CT scan of the 95-year-old patient, and you can also see in exactly these regions COVID-like changes, but all in all not such a big extent, and the patient was sent home in the meantime. Last case I'd like to present you is a 32-year-old patient with chest pain and dyspnea, and we did a so-called Davos sonography, which means we were positioning the transducer exactly on the region where the pain was. So we performed with a pocket ultrasound device a lung ultrasound exam with a linear transducer at exactly the point with the maximum of pain, and here you can see the lung ultrasound picture, and you would say, oh dear, what's going on here? Consolidations or maybe some fragmental pleura? Is it COVID? No, it's not COVID. It was the 1st September 2016, and there was not COVID yet. So we were having a look with different transducers. And here you can see it the following day with our big machine, and you can see this is a typical picture of a peripheral lung infarction. And if you go on examining the patient, you can see where's the pain in the leg, and there you can see a little thrombus inside a muscle vein. So this was a muscle vein thrombosis with the pulmonary embolism. So ultrasound did a great job, but I just wanted to show you the picture from the lung is very, very similar to the ones we've seen in the COVID-19 pneumonia. So I don't know whether we see a lot of lung infarctions in the periphery when we get pathology specimen from patients dying from COVID-19. So if you'd like to learn more, you want to see more cases, I just can recommend you the German page from Michael Höppner and Hans-Peter Westcott, www.covid-sono.com. There you can see some more cases. The words are in German, unfortunately, but the pictures are quite international. And last but not least, I'd like to conclude. COVID-19 lung ultrasound. Please be careful and prepared when you perform it. Stick absolutely with the hygiene protocols. Be careful. We need you. Work focused. Best use standardized lung ultrasound protocols. When you're in a room with a COVID-19 patient, you're a little bit under pressure. So use standardized protocols, not to forget a region and not to forget a criteria. Try to participate in local COVID-19 lung ultrasound studies. We have to learn more about this cruel disease and about the cause and about the possibilities of lung ultrasound for monitoring these patients. And if you are from Germany, Austria, or Switzerland, please be part of our COVID-19 lung ultrasound multi-center study team. We would warmly welcome you. If you have questions concerning the COVID-19 lung multi-center study or lung ultrasound protocol, please feel free to send me an email anytime. Not least, I'd like to thank all members from the ultrasound section at the Department of Nephrology, the Klinikum Rechts der Isar, with our Nephrology Department Chief Uwe Hiemann, and especially Rigmar Braren, one of our CT COVID-19 experts at the Department of Radiology, as well as all other co-workers in the Klinikum Rechts der Isar. and I thank you very much for your kind attention.